Health services at Yambio State Hospital have been restored after the hospital nearly collapsed following the withdrawal of the Health Pooled Fund in April 2022. The facility in Western Equatoria State received support this July through a new health sector transformation project led by the National Ministry of Health in partnership with World Bank and other donor partners. This is part of a 3-year multi-donor project in which UNICEF and World Health Organization support the implementation of health services delivery and strengthen the health systems as managing organizations. Officials in charge of the maternity unit at the facility have reported an increase in deliveries compared to the period between January and June.
At the beginning of this year, we had no mothers, many mothers who are coming for delivery due to the condition of the hospital, lack of drug supplies and other materials for conducting deliveries. So in January, we had 32 deliveries per that month. Then in Feb, we had only 15 deliveries. In March, we had also 15 deliveries. In April, we had 28 deliveries. Then in May, we had 30. Then in June, we had 32. Coming to July, we had 112. That's when the hospital started receiving many mothers coming in labor. Out of that 112, we had also number of cesarean sections. 18 were operated due to different conditions. Then for August, we had 152. Now the number is keeping on increasing.
The pediatric ward at Yambio State Hospital also continues to register an increase in the number of children admitted with different conditions. According to the report, the facility admits between 12 and 15 children a day and can see close to 300 children admitted in a month.
This ward is a very busy ward. We admitted children 300 and some fraction per month. Per day, we admitted 12, 15 per day. It is malaria cases, pneumonia, and diarrhea. Yeah, that is a common case, and anemia.
Some Yambio residents who accompanied their family members for delivery and to access services at Yambio State Hospital said the services have improved at the facility. The improvement comes after the new intervention from the national government.
في مشاكلات اللي كان ورا كلامات بيجا طبعا المستشفى كان ما حقيقة كويس كان هو ما زي هو كويس أنا بيكونوا مرتاحين لكن بدر كان ورا نادنا كان ما مرتاحين كل.
Another resident of Yambio town in Western Equatoria State has also confirmed that the services at the state-run hospital have improved. The residents believe there is a need for the government and development partners to support the facility in continuing to provide affordable services to the needy population in the state.
It needs more help from our organization to help them and to support them more, to motivate them to help our mothers, for them to be healthy and for the kids to be alive. Because many mothers are facing challenges if health workers are not being supported well.
In April 2022, Yambio State Hospital was in a poor condition and on the verge of collapse after the Health Pooled Fund ceased paying incentives for healthcare workers, drug suppliers, and technical assistance. However, the new health sector transformation project, which began in July this year, intends to support about 1,158 health facilities across the 10 states and 3 administrative areas over a 3-year period in South Sudan. Despite the new intervention, healthcare workers at Yambio State Hospital say the government's delay in paying their salaries remain a challenge.
Before, we are having a challenge for medication, but for now we have medication. Yeah. For the salary, we cannot talk about it because since when up to now we are working just for helping our people.
Yambio State Hospital is considered the main referral hospital in Western Equatoria State, offering maternity and pediatric care. It provides surgical, laboratory and pharmacy services as well as inpatient and outpatient services among others. As of recently, the facility has witnessed an increase in the flow of patients after UNICEF's intervention through Amref Health Africa.
Some 3 years back, the hospital was really in a very big challenge. 1, drug was not there. 2, hospital was not supported in terms of motivation to the staff. And then some staff even deserted from the hospital because they were not motivated. Early this year, the hospital is now fully now with services. The drugs is available now. Now the promises are already also there. Amref already started paying people, at least paying fee people about 118 staff being supported. Though they are not all are supported, but some of them are supported, and then the drugs is available. And the other challenges, I think, because we belong to the government, it is completed almost 1 year now, so salary is not regular. So of recent, we have just received 1 month, which was October of last year.
The hospital has so far received 6 new doctors of different specializations who are supporting the smooth operation of the facility. However, the facility still needs constant power supply, an ambulance to respond to emergencies, and other necessary supplies, according to the officials.
The partner is on the ground, so they have not yet fully started, but they started with supplying us with the drugs. Well, we have basic things like even the ambulances are there. They are broke, so they have not yet come yet to start repairing their ambulances. These are the situation we are having, because when we want to, maybe the community, a patient is in the community, so it is very difficult to bring the patient to the hospital because the ambulance is not there. So we have already said with the Amref who is on the ground coming to take the hospital, we have presented the first things for them to do for us is to maintain the ambulance, to put the ambulance on the road. Number 2 is we don't have basic cleaning material like soap, all that one. We don't have it, and then we also presented to them, please, we need this urgent because without cleaning material, so that is difficult for the doctor to touch the patient.